Hello, my name is Allison Young from Team Frontier Medicine, and I'm here to give an overview of our poster presentation entitled Innovation in Pediatric Access to Healthcare Using a Statewide Provider Collaborative and Cross-Sector Collaboration. Our team of four launched into this work several years ago, and we often try to contextualize our work by looking at the health outcomes in our state and our region in Montana. We begin at the background section really just to state the challenges we face in child health. Geographic spread and distribution of healthcare resources lead to uniquely challenging problems around access to healthcare. And it is access to quality healthcare that became the focus of our Wicked Problem Impact project. Moving down the left part of our poster slide, our WIPIP focus is to build a collaborative pediatric workforce by utilizing new adaptations of telemedicine to improve access to quality pediatric care. Prior to launching into this work, we were realizing the existing options of telemedicine and innovation in providing telemedicine care to patients within our state were coming from outside the state. They were not rooted within the medical home practices that physicians in our state in which they practice, and they were largely being conducted in silos. And we began to imagine what it would look like if we could use the limited workforce that we have to unify under a goal of providing improvement in access to care through technology. The primary tenet of what we set out to achieve in the use of technology really is to see the pediatricians in our state as collaborators. And in our area, one of the true limiting factors is the great distance between urban areas. Pediatricians are limited in number and reach, and many areas don't have any access to a primary care pediatrician, and no specific pediatric access to care outside of regular office hours. The middle graphic, from isolation and silos to continuity and connection, really defines three main areas in which we've set out to have impact. Firstly, meaningful access to care, impact on the challenges to the public health system and the economics that are somewhat defeating at times to both families and providers, and then looking at transitions in care, particularly for youth with complex medical needs. Our activities have been focused on building the collaborative. Many of our initial champions and collaborators were found within our state AAP, American Academy of Pediatric chapter. We initially had a buildup of recruiting champions in year one, and in year two, we've managed to build a collaborative that incorporates about a third of the providers in our state, covering 52 weeks of continuous after-hours telemedicine coverage to Montana's children and families, all of which is embedded in the medical home. And then we've also designed and completed a maintenance of certification Part 4 project among participating providers to assess how provider comfort with technology improves over time and use of telemedicine. And that has been significantly impacted by the COVID-19 pandemic, as it turns out. Multiple family, community, and state engagement, health system engagement with 5 health systems in the state collaborating with us, and payers working with our team, and Blue Cross Blue Shield of Montana has invested about $400,000 in advancing this model of innovative and collaborative technology-based healthcare solution. The findings we chose to present here on the right side include data from surveys across our states, really to show the number of voices that went into helping us understand initially access to healthcare and use of technology. And then a respondent survey from our pediatric champion group, our initial collaborators, regarding perceptions of barriers to health equity for children. And those have been the responses have been used to try to build toward new directions of work to further impact health equity in our state. Our future directions include ongoing provider recruitment and training, improving the equity access through outreach to our Fort Peck Indian tribe initially, and hopefully to additional Native American health shortage areas in the future. Ongoing evaluation of technology, expanded after-hours virtual access, and then deployment of cloud-based shared care plans to improve care coordination for children and youth with complex medical needs.